Hi friends, my name is Dr. Vicky Kuldeep. I am a general and lab surgeon associated with SCI International Hospital, New Delhi. Today we'll be discussing about Gallstone disease. To begin with, we'll discuss where the gallbladder is actually located. It's an organ which is adjacent to the liver. It's present on the right side of the upper abdomen of the body. Basically, the presenting symptoms of the person depends upon the condition or the situation in which the patient presents. To begin with, the patient may present with the biliary colic, which is the pain because of the stones. The pain is typically present over the right upper abdomen, which radiates to the back. It's the presentation of the biliary colic, but if the patient presents with cholecystitis, which is the gallbladder infection because of the gallstones, the patient presents with pain which is located in the right side of the abdomen, upper part. Then there is fever, plus minus there can be this possibility of vomiting and jaundice. The other presentation can be cholangitis or an obstructive jaundice, which basically is a complication of gallstones. It occurs when the gallstone slips and further obstructs the biliary passage. Then the patient presents with a deep jaundice, which is pilia, and the patient's presence with fever. It is associated with shivering, severe pain over the right upper abdomen, itching all over the body. These are the presentation of cholangitis and obstructive jaundice. Another complication which may occur is pancreatitis, which again is a severe complication of gallstone disease. In that scenario, patient presents with pain in the epigastric region. It's basically upper central abdomen. It's a severe pain which is radiating again towards the back. It's very severe pain, not relieving with any kind of painkillers or antibiotics or anything. This is a life-threatening condition, and this is the presentation when the patient presents with pancreatitis. This is all about the presentation of the patient. Then we'll be going towards the diagnosis part. Basically, to diagnose gallstones, ultrasound is a very good modality. If at all ultrasound presents some kind of complication or some doubtful picture, then and then only we go towards MRI. The MRI dedicated for this gallbladder and the biliary tree is called as MRCP, which is called as magnetic resonance cholangiopancreatography. These two are basically required to confirm the gallstone disease. Then moving towards the treatment part, first we'll be discussing about the medical part. The medical management is there to deal with the complications basically. If at all the patient presents with the biliary colic as we discussed earlier, then we'll treat the patient with the painkillers. If the patient presents with cholecystitis, then the patient will be treated with antibiotics and painkillers, which may require an indoor admission. If the patient presents with obstructive jaundice or a cholangitis, then the patient will be admitted and will require injectable antibiotics, painkillers, and to relieve the obstructive jaundice, we'll have to do a procedure which is called as ERCP. That basically means an endoscopy and removal of that obstructing stone and placement of a stent. Then and then only the jaundice will get relieved. Coming towards the pancreatitis part, it is the most deadliest complication of the gallstone disease. This may require an extensive stay at hospital. All the intensive management will be required. This completes basically the medical management of the gallstone disease. And for the ultimate cure, the gallbladder needs to be removed. The ultimate curative procedure is only laparoscopically removal of gallbladder. It's advisable that you should deal with your disease early so that you will be able to avoid all the named complications. The life is very precious. You should act fast and you should be able to diagnose your problem very early. Then and then only we'll be able to help you at the earliest. For any more information, you may contact Cure India. Thank you very much.
If you are interested in treatment in India, please subscribe to our channel and press the bell icon to never miss a new video from us.